Ciprofloxacin against pneumonia. What is pneumonia? Pneumonia occurs when bacteria enters the alveoli and infects the tissue there, causing an inflammatory reaction that can lead to the alveoli to fill with pus. The following symptoms may occur as a result of pneumonia: coughing, difficulty breathing, chest pain. People over 65 are at most risk with pneumonia. What type of infections does Cipro kill? Cipro is a bacterial antibiotic that is used to treat infections. Infections such as pneumonia, gonorrhea, typhoid fever, and others can be treated with Cipro. Cipro can also be used to prevent the spread of bioweapons such as anthrax. Some bacterial infections in the kidney can also be treated with Cipro. What is Cipro? Cipro belongs to a group of antibiotics called fluoroquinolones. Fluoroquinolones are an antibiotic class that has been recognized to treat or prevent pathogenic bacteria. Because of its potency, patients are prescribed Cipro through a doctor. How does Cipro work? Part 1. Cipro inhibits two important enzymes which are involved in the process of DNA synthesis. These two enzymes are under the category as topoisomerase. Topoisomerase are vital to bacteria and DNA replication because they prevent double helix responsible for DNA replication from closing up and being twisted. How does Cipro work? Part 2. Cipro targets two different topoisomerase, DNA gyrase and topoisomerase II. Cipro forms a double-stranded break in the DNA by binding to DNA gyrase and topoisomerase II. Double-stranded fractures are often lethal to cells because they damage the base of the DNA strand, preventing DNA replication. How does Cipro work in the lung? Part 1. Cipro is delivered to the lungs using a dry powder inhaler. Cipro will finally reach the alveoli by passing via the trachea, down the bronchi, and through the bronchioles. Once the powdered Cipro reaches the alveoli, Cipro will begin to target the bacteria in the alveoli and halt bacterial reproduction. How does Cipro work in the lung? Part 2. Cipro will target DNA gyrase and topoisomerase II, the two primary enzymes involved in bacterial reproduction. Once this happens, the Cipro induces a double-stranded break in the DNA, causing the bacteria to die and the virus to stop producing. The person will acquire a cough once majority of the germs has died. How does Cipro work in the lung? Part 3. As soon as a cough appears, the body will begin to eliminate any residual germs or pus from the lungs. In addition, the body will begin to absorb the fluid and the alveolar sacs. 1 month after the onset symptoms, the alveolar inflammation subsides and the injured alveolar membrane heals. How much can Cipro cost? Cipro is a cheap and efficient antibiotic. A 100-gram bottle of Cipro normally costs somewhere around $20 and $25 USD. A 500-gram bottle of Cipro costs between $60 and $70 USD. What are the side effects of Cipro? Despite the fact that Cipro is a highly effective antibiotic, it can have certain unpleasant side effects. Cipro side effects include the following: diarrhea, nausea, tendinitis, vomiting, and a bloody stool. And in uncommon circumstances, a damaging impact on the central nervous system, which can result in spinal cord injury. Social concern. Bayer has been sued in a number of class action lawsuits because research shows the benefits don't always outweigh the risk when it comes to taking Cipro. Cipro can lead to aortic dissection. This happens because Cipro affects with the aorta's inner lining, which might result in a lethal response. Social concern part 2. Mice were administered Cipro as a part of a study. A large number of the mice had aorta-related issues after the test. Aortic ruptures were deadly in 15% of the mice with strained aortas. Aortic aneurysms were found in 24% of the mice, however there were no ruptures. Aortic aneurysms and dissection were seen in 79% of the mice with stressed aorta. Social concerns part 3. Aortic difficulties in the mice demonstrate that Cipro can cause deadly rupture in the heart and damage crucial elastic fibers. This demonstrates that Cipro is a risky drug that can cause mortality in those who already have cardiovascular issues. An aortic rupture would result in death and backflow of blood.